Shall we start? Good afternoon, students. So let's start with the common clinical scenario. He's a 62-year-old gentleman came to my OPD yesterday. He's on 3 anti-glaucoma medications, but his IOP in right eye shows 24 millimeters of mercury, in left eye shows 22 millimeters of mercury, with cup disc ratio of 0.6 in right eye and 0.7 in left eye. He also has progressive visual field loss. So, do we pose this patient for a trap, or is there any other safer surgery? Yes, this is where minimally invasive glaucoma surgery comes in. It's a set of innovative procedures designed to lower the IOP through tiny ab interno approaches. These are my learning objectives. You can see. Okay. It has extremely high safety profile, rapid visual recovery, shorter surgical time. Also, MIGS can be combined with cataract surgery. MIGS is commonly indicated for mild to moderate glaucoma, yes, and in cases of failure to medical therapy. Of course, for advanced glaucoma, students, you have to remember, we usually prefer trabeculectomy. Similarly, MIGS is contraindicated for active neovascular glaucoma, angle closure glaucoma, corneal opacity, and angle distances. Listen, I will ask you in the end why these are all contraindicated for MIGS. Okay, let's classify MIGS based on where they enhance the aqueous outflow. Also, tell me where is the maximal site of resistance in the trabecular meshwork? You? Yeah, very good. It is the juxtacanalicular meshwork. Coming to the implants, implants are improving the aqueous flow from anterior chamber to Schlemm's canal. It's actually act as a bypass. You can see the eye stent, and this is the eye stent inject. These are tiny titanium stents implanted into the Schlemm's canal, which will improve the aqueous flow by bypassing the aqueous humor. You can see the hydrous micro stent. It acts as a scaffold to dilate the Schlemm's canal, and also it improves the aqueous flow. Okay. Coming to the set of procedures which will excise or cleave the trabecular meshwork. Okay. Can anyone of you name this device? Very good. It is Cahoog dual blade. You can see here the 2 blades of this device, no? Beautifully cutting the trabecular meshwork. Okay. So this is a reusable one, Tanito micro hook. It also helps to cleave the trabecular meshwork. Very commonly done procedure, bench ab interno needle goniotomy. A 27 gauge needle, its tip is bent and it is used to cut the trabecular meshwork. Very popularly done one, GAT, gonioscopy assisted transluminal trabeculotomy. Here a 5060 Prolian suture with a blunted tip is inserted into the Schlemm's canal and advance it 360 degree. Once it enters back into the anterior chamber, grasp both ends and the suture material is gently pulled through the trabecular meshwork and we can create the 360 degree trabeculotomy here. It's very important. It's a very commonly done procedure also. Coming to a procedure which will dilate the Schlemm's canal also. You can see here a illuminated microcatheter will pass into the Schlemm's canal, advance it 360 degree. We can see the path of the canal by this illuminated tip. Okay. Once it withdraws the Schlemm's canal, see beautifully the viscoelastic substance is injected into the Schlemm's canal. Thus the canal will dilate and we can improve the aqueous outflow. So, coming to the end, what is ECP? Fast, endocyclophotocoagulation. Here a controlled laser energy is used to ablate the ciliary process. Okay, similarly the hyphema is the commonest complication. In short, MIGS ensures adequate IOP control which help to improve the patient's overall quality of life. Okay students, why corneal opacity is contraindicated for MIGS? Anyone? Because if cornea is opaque, then we can't see the angle structures properly, right? Okay, you can find why others are contraindicated for MIGS. Okay, and you can also read more about trabeculectomy. So, any doubts about MIGS? Okay, see you in the next class. Thank you.
Doubts are there, madam?
Yes, sir.
Any madam, any IOP criteria where mix can be done or should not be done, or which type of mix can be done? Any pre-operative IOP criteria?
It indicated commonly for mild to moderate glaucoma cases. IOP criteria in very high-end IOP, we can't do mix because it is advanced glaucoma. If we do mix, it can achieve the lower IOP. So, it is better for approaching with a trabeculectomy in there.
No, any IOP criteria is what he's asking, but below this much, above that much, no. Nothing like that. It's okay.
I'm not remembering. I will refer and come
Any other
back.
question? Yeah. You will refer and answer.
Yes, sir.
Ma'am, there is a patient of neovascular glaucoma. What should I do? Which surgery I can do? Can I do mix?
Of course, you can't do mix because in neovascular glaucoma, there will be new vessels are in the angle, right? So what will happen if we touch the angle? Torrential bleeding will occur. So we can't do mix. We can try for medications, but I don't think there is a scope for surgery. I will refer and come. I'm not sure.